Welcome to Kian's Kiosk, insightful ruminations on the continuum of care.
Hello everyone, this is Kian Sane. I'm the founder and CEO of Independent, and I'm thrilled to have with me today Lynne Giacobbe. Lynne is a wonderful, amazing leader in senior living. She's the CEO of Kendal at Home. She'll tell you all about that. And for me personally, she's a friend and a colleague and a mentor and someone I've looked up to since the moment I met her. And very importantly to Independent and myself, she was literally our first customer. So we wouldn't exist but for Lynne. And I'm thrilled to be spending time with her today on this podcast and having her talk to us about what a life plan at home community is all about and what her services do and how they're different from home care, home health, senior living, and how they fit into the continuum of care. So Lynne, welcome. It's great to be with you today.
Thanks, Kian. Thanks for having me on today. I appreciate it.
You bet. So Lynne, why don't we start off with you talking about Kendal as a corporation as a whole, Quaker-based, and also how Kendal at Home is different than the other communities that are, and I think, even a different entity at this point.
Thanks, Kian. Yes, actually we are. We're part of the Kendal system. We're one of a dozen affiliates that are part of the Kendal system, and most of those affiliates are continuing care retirement communities or life plan communities, as we like to call them today. And they're places where people go to live. They are healthy and independent and are looking for a lifestyle and want to live on a campus. And we have campuses all across the U.S., one opening near you soon in California. And that'll be our newest affiliate. And, but Kendal at Home is an entity that offers a similar kind of lifestyle, except that it really enables people to stay in their own home. So as people age and they're still healthy and independent, but they're looking for some of the benefits that they might encounter if they were to be part of a life plan community, but they're the people that really just don't want to leave their home. And they like what they have to offer, but are really looking for the opportunity to be able to remain in their home. And we, like all of our affiliates, are based on those Quaker values. Those are really core and central to all the work that we do, whether we're talking about from the board of directors. We just did a board retreat last week, and it was really focused around those values. And they're central to our work with our members as well and those that we serve. So that, I think you see it in everything that we do. It's really what drew me to Kendal in the first place, and in many ways it's what keeps me here today.
Well, I know for a fact that from Sean Kelly, the CEO, to yourself and everyone else I've interacted with through the years at Kendal, that you guys walk the walk and talk the talk, and it's the values are not just marketing slogans. So that's palpable.
Thank you.
So help me, well, I think I know the answer, but for our listeners, help everyone understand the difference between Kendal at Home versus, let's say, home care versus home health, because each one of those are distinct. And before you do that, I'll share some statistics which really talk to what you just said. Of 100 people who could go into a community, and I'm sure you know this better than I, 93 of them never consider moving from their home. So that's where your market is, that small slice of 93%. The other 7%, 4% of them actually do go into a community and 3% don't. So really we're talking about 96% of the folks, 93 never consider, 3% consider and don't go, are staying at home, aging in place, and so that's your market, right? And help us understand how that's different from home care and home health.
Thanks. I think it's often misconstrued. People hear the word Kendal at Home and immediately think this is a home care agency or home health services. And while home health and home care are critical components of the work that we do, Kendal at Home is really a comprehensive long-term care plan for someone. I think about sometimes that analogy when you think about a general contractor coming in and bringing in all the subspecialties to accomplish a project. In many ways, when someone joins this program and they become a member, the key to this program is really care coordination. And if you remember that I said when members come into the program, typically they're healthy and independent. And that doesn't mean that, they might have arthritis, they might be dealing with chronic conditions, but for all intents and purposes, they're able to function on a day-to-day basis and perform their activities of daily living independently. However, that care coordinator is really working with them, number one, to really be focused on health and wellness, to eliminate risk, to try to promote the best quality of life that that person's able to accomplish, and really to help them achieve their personal goals. Sometimes, though, we need home care services, or we might need home health services, and the difference between the two is home care is typically personal care, private pay, not covered by insurance typically, not by Medicare anyway, or Medicare Advantage plans. Home health is covered by your Medicare and Medicare Advantage plans in some cases, and it's a skilled service like physical therapy, occupational therapy, speech therapy, but things of that nature that you might consider a rehab after a surgery, a hip replacement, or something like that. And our care coordinators are really bringing together all of those services that a member might need at any given time and coordinating all of that, making sure that their needs are being met and that they have the best opportunity to regain whatever level of independence they might have lost as a result of surgery or, an illness or something like that. But Kendal at Home is really a much more comprehensive long-term care plan that enables members to age in the place they want to be, and hopefully empowers them to be able to achieve those goals as well.
I know you do that. I know your team does that. As you know, with Independa, what we do is we really address the continuum of care on our side. We go from patient education from the hospital all the way to being integrated inside LGTV so the consumer can actually have a way to remotely engage and get educated and get care in their own home. And everything in between. And the in-between is senior living, short-term rehab, home care, home health, but also PACE programs. So personally, Lynn, and I've shared this to you privately, that the two models in that entire continuum of care in our healthcare system that I believe are the best representations of what people want are PACE and what you do, Life Plan at Home. And the reason is that you are on the same side of the issues as your members. So you're their advocate, you do care coordination, you look out for them, anything happens, they call you, and you're there for them for the rest of their life. And whatever they need, you're responsible and there for them. And that gives huge comfort and also huge results, because you want them to stay in their home, because you are to some extent, if not a great extent, on the hook if they don't, right? So if they must go to the next stage of care, financially, that's a big issue for you. So you are totally committed to their health.
Kian, I think nobody's joining this program because they want a good nursing home, right? They want to stay at home. And, over the 19 years that I've been here, 98% of our members have been successful in doing that. Most people are not going to nursing homes. And, across the country, we see many of our communities are either completely eliminating or decreasing the number of skilled beds in their communities. And we know that people can be cared for at home. Oftentimes we are able to bring those services to the home in order to enable people to be able to remain in their homes. But we're paying for that care, whether they're in their home or in a nursing home or in an assisted living or memory care in most cases. There are some options where people can opt out of the facility care component of membership, but by and large, most people in this program have a benefit that would cover them wherever they choose to go. And I think that's the key, is that they choose where they're going to go, or maybe it's their healthcare power of attorney who's going to be helping to advocate for them. But by and large, those decisions are made by the member and by their families. And our goal is really to provide the supportive services to enable them to remain in their home. So technology is a key factor, right? I mean, if we're going to enable someone to be at home, and I know this from personal experience, sometimes you have to have help in order to do that. And I mean, help beyond just services. And if the pandemic has taught us anything, it's really taught us how to tie in technology and how to enable our folks to stay socially connected in ways that have been critical over the last couple of years in particular.
I think there's a lot of great technology overall, Lynn, and we're proud to be in that group, but I have to give you incredible credit, and I'm going to give some examples of that. A few sort of life-changing things that just between you and I, you have done with Independent, with myself. One thing was when you were about to become a customer, we had another group who was about to also become a customer, and they were in short-term rehab. And this was much earlier in our life as a company. And I remember you said to me, you said, no, we'd like to be first. And I thought that was amazing. And normally people are taught, no, don't be first, let everybody else do. But you said, no, we want to be first. And it wasn't that things were always going to be perfect. It was that you were a perfect partner to make things better. And I think the industry could use a lot of that, where innovation doesn't happen just because you get up and speak and present at conferences. Innovation happens where a rare leader like yourself says, we're going to leverage technology, we're going to invest in technology, we're going to learn about it, we're going to teach about it. So I thank you for that, because if there's no first, there is no tech company ever. Mm-hmm. Somebody has to be first and somebody has to step up. So that's that. And then the other two things, which for the listeners, I asked Lynne's permission if I could read these two texts to me. This was from January 19th, 2016, if you can believe it. Time flies. I got this text, and I've gotten a lot of texts, but these two really stand out for me in my years at Independent. And Lynne wrote, Kian, I wanted to let you know that I lost my mom this past Sunday. She died peacefully surrounded by her family. Thank you for all you have done for us this past year. And it still chokes me up. And we went back and forth, obviously, with my condolences. And then Lynne said, if it's okay with you, Kian, I would love to transfer my mom's account to my dad and have him become the care recipient now. I think he's going to need some kind of attention like my mom has needed over the past year. And of course, it was fine. And it was amazing that your dad was using the system, if I recall, for pictures. And he had his friends over, and he was sharing the pictures on these big screens. So not the same application as your mom, who had thresholds and alerts. And then the most touching one for me was when you said, we hadn't even left hospice after my mom died, and my dad asked, in quotes, what about Independent? So sweet. And so that has driven me, Lynne, in many ways through the years, as an example of what we can do. And the only reason that was possible was your leadership, but also you took on the system yourself as a user, not just as a leader. And you brought in the devices, you brought the TV into your mom's home and at the foot of her bed. And just tell us about the trip that you and your dad took and how that affected her. And that was very meaningful to me.
I think there were a number of factors for me. My mom was very ill for, the last year and a half of her life. And she was dealing with a lot of chronic conditions. And I was her primary caregiver from a family standpoint, as well as my dad's. And my dad was nearly 90. My mom was aging as well, was, I think, in her 80s at the time, and very ill. And I was traveling quite a bit, and I needed to be able to manage her medications. And she had congestive heart failure and would often have increased fluids, in which we had increased diuretics and those kinds of things. And the technology through Independent allowed me to keep track of her weight. So if I were to call her in the morning and say, Mom, what was your weight today? She would be very offended by that. And I would be if she asked me as well, right? But she stood on that scale religiously every morning, and I never had to ask her, because her weight registered, and I knew I would get an alert and it would tell me. And then I could tell my dad, increase this blue pill and give this to her at this time and manage it. And it allowed me to be able to still be instrumental in overseeing her care, even when I wasn't right there with her. But I think one of the most powerful moments for me in that year and a half was my dad had an opportunity to take an honor flight trip. And he had been waiting to do the honor flight for years. And he got called that his time was here and he got to go. And my mom was really sick, and obviously she couldn't go. She couldn't be a part of that. But throughout the day, I happened to be in Maryland at the time, and I was able to meet him there, surprised him at the Korean War Memorial. And I was able to upload and send all the pictures to her live. And she was able to be a part of it. And I'll never forget that, because I can't imagine what that's like to feel so isolated and be homebound and know that you can't be a part of things that are so important to you. And she and my dad had been married for nearly 60 years and probably hadn't, encountered many significant things in life separately. And so I think it wasn't the most critical of things, but it was so critical to them. And to my mom in particular, for her to be a part of that throughout the day. And she was so happy to be able to experience that with my dad at some level. And that wouldn't have happened had we not had that technology in place. So, yes, I think there's lots of challenges with integrating technology, and you and I have had our share of them. But I think if we don't forge through that, if we don't fail and learn to do better, if we don't learn how to adapt things and we overlook the benefits and the positive things that come out of it, it's unfortunate for all of us. So for me, having had that personal experience, and I was adamant about that personal experience, because if I'm going to roll something like this out to hundreds of members, my credibility is at stake too, right? So I want to make sure that I know how it works, that I can operate this, that I know the benefits and the challenges, and that I can speak to that. And so I think those were some of the key things. And I think the others were some key members that were really the champions, right? They were ones that stood up and said they wanted to really launch this technology and integrate it in their lives as well. So those are, I think, a couple of things that really stood out for me during that time. And I think they were amazing. They made it possible for me to still help my mom even when I couldn't be at her bedside.
Well, you're amazing. Your dad's amazing. He's still with us. And he
is ornery as ever, I'm telling you.
And I'm sure he
92
celebrated
years young.
another wonderful Veterans Day. And we lost your mom, but it was amazing to be a part of the last year of her life.
Thank you.
I remember the picture that you sent one of your members, the lady who had...
she had Lewy bodies dementia.
Lewy bodies dementia. And she had the lay around her, and your member had said that she would not have been able to see her grandson's dorm as he studied in a Florida university, but for this experience.
Right.
So speaking on behalf of all of us on the technology side in the industry, those things really drive us and drive me personally, drive all of us at Independa. And none of that can happen without leadership like you. So again, I thank you, and not just as a customer and a leader, but as somebody who allowed us to be here. But for you, if there's no first, there's no second or anything else.
I think technology is so critical, right? We're all so dependent on that, and it can enhance our lives in so many ways. So I'm grateful for creative minds that can do things I could never do. So I think it's a partnership, and it's an important one.
Thank you, Lynne, so much. So back to Kendal, and if someone is listening and they would like to hear more about Kendal, of course, your website is fantastic. I love your tagline of reinventing retirement living at home. Most of us, like we talked about statistically, would like to stay at home. So you really are the the key, the magic to enabling that, from what I can tell. And I know the industry is just like many others. Transactionally, you can get home care. Insurance can pay for home health for a certain amount of time. But to really have a person who cares for you through the rest of your life, plans for your health, plans for your preventative measures, and plans for your success, and is economically on the same side of your interests, that's really important. If I fall and I have an issue, somebody makes money on the home health side, somebody makes money on the home care side. You don't make any more or less money. In fact, you make less money the less healthy I am. So you're driving health into my life for the rest of my life, and I think that's key. So if someone is interested in learning more about your markets, the current ones that you're in or the ones you're planning to enter, how would they go about that, and how would they connect with you?
I think our website's a great place to start, kahome.kendal.org. I think that, anytime someone wants to know more, call us, because there's so many programs out there that are doing this work now, and we're seeing more and more every day. Kendal at Home serves members that live in Ohio, Kentucky, and Massachusetts right now. So we're in those 3 states. But the beauty of this program is that even if someone does move and they leave Ohio, why would anyone leave Ohio in December or January? Or maybe they live somewhere part of the year in Ohio or Massachusetts or Kentucky. The same thing. They can move. This program is portable, and we go with them. We have a member who lived here in the Cleveland market for many years, and she and her husband joined the program. They moved to Maryland to be near family, and he was diagnosed with a rare and progressively debilitating diagnosis a number of years ago. And we have traveled that journey with them for many years now. And over this past weekend, he died peacefully at home, surrounded by his wife and his children. And, I'm proud to say that our care coordinator has stayed so connected with them and worked closely with them throughout. She even traveled to Maryland to work closely with them over this past year. And, I think it's that relationship, that key to being able to provide the kind of services that people need and depend upon. And they built that relationship. Our care coordinators sort of become like family to our members. So I think that people can move and travel anywhere, and we'll continue to serve them. I think we serve members in about a dozen states right now, but typically they start out in one of these 3 states, and then we can serve them beyond that. But our phone number here is 440-835-8681.
Thank you. That's terrific, Lynne.
Thank you.
Combining the Quaker and Kendal commitment of lifelong learning, which I think is a terrific, position and passion to have, and then yours, which is a lifetime guarantee of care and services. Now, I'm going to pause for effect. Lifetime guarantee of care and services that you provide your members. Help us understand. You go through lots of, measurements with actuarials and insurance companies that specialize in this area. You have to be around, you have to have the assets and the backing to be able to take money, very little money monthly today, to be there for someone 10, 20 years, 30 years down the road.
Right.
So help everyone understand that's a really powerful model and comfort that someone picks up.
Yeah, so when someone joins the program, they're going to pay an entry fee that's based on their age and the daily benefit that they select. And then they'll pay a monthly fee, and there's some flexibility around what those monthly fees are. People make personal choices about how they want to structure their investment. And in essence, what they're basically doing is investing today's dollars for their future care. And so they can preserve their assets and really have a plan in place. We spend so much time planning for retirement, but very little is spent planning for our long-term care. And inevitably, we're all going to need some level of care for some period of time. Some of us will need it long-term, and others, may be really fortunate and not need a lot. But ideally, I mean, we have spent a lot of time really focusing our efforts around wellness initiatives. We're just launching a program called Stepping On that's really focused on falls prevention. And then we've integrated a personal training component in addition to that. And we're measuring the impact that those initiatives are having in members' lives. We know that the greatest number of dollars are being spent on people with cognitive impairment or injuries related to falls. So if we can help prevent falls from happening and improve quality of life or prolong quality of life for our members, those are our number one goals. So we're really focused on that prevention and education, but then really working hard to be able to manage the care as we need it and manage it effectively. But we work extremely closely with our actuary, and Brad Paulus is our actuary with Continuing Care Actuaries, and he's been a partner with me for 20 years, 19 years. And I'll tell you, I couldn't do this work without people with that sort of experience and expertise that really helps to guide our financial model, and he works closely with our board to help them as they have to make financial decisions about the program. So it is a partnership, and it is really, monitoring our track record and our results and what our projections are for future care costs so that we can be financially viable to meet those care needs in the future.
Yeah, that's amazing and so valuable for people to understand that it's really not about transactional or monthly payments now.
Right.
It's about being around for forever, really, for
Right.
the comfort of your members. And there's a lot of science that goes behind that, and a lot of effort, and lots of people supporting you behind the scenes.
It just triggered for me, we talked a little bit about home care and home health, but I think what often people will compare the at-home programs to a long-term care insurance product. And you talked about that personal relationship and how critical that is. And, you think about long-term care insurance is really about reimbursing someone for their long-term care costs down the road and meeting the criteria that they've established. For the at-home programs, it's much different. We're all about meeting the needs of members, and they need help with one area of activity of daily living. The at-home programs step in and are providing services. And as you mentioned, it's a lifetime commitment. There isn't a daily or a lifetime cap. We have a daily benefit amount they'll select, but they can need care for the remainder of their life. And oftentimes people do. And we're going to be there to support them and provide those services for as long as they live.
Yeah, and again, going back to the PACE program, similar to yours, in that case, it's public funded, right? So you take Medicare and Medi-Cal or Medicaid dollars, and it takes a lot of energy and expertise and compliance to become a PACE program. But once you are,
Right.
then you're fully aligned with in their case, they call them participants. And the participants don't want to go to the next stage of care. They want to stay in their home. And oftentimes they have to be admittable to a nursing home. So that's the qualification to then get into PACE. But now you have doctors and clinics and physical therapy and social engagement as part of the program, everything else to keep you healthy at your home. We don't hear that in the healthcare world, like when you're talking about long-term care insurance or any kind of insurance. It's really to pay for the episodic thing that goes wrong.
Right.
And by then, I don't want to be in that position. I'd like to prevent that thing that goes wrong. And PACE and you prevent those things that go wrong for as long and as much as possible. And that's really where I get excited about your model, because you have someone who cares for me for the rest of my life, and cares for me as much as my best sibling or best daughter or best family member. And financially, you're on the same side of the table.
Right.
So that's huge.
Walk that journey with you.
Anything else, Lynne, you would like to add?
No, thank you for having me today. I appreciate it. It's always good to see you, and I appreciate the opportunity to share a little bit about Kendal at Home.
It's my pleasure, Lynne. You are a leader amongst leaders, and I'm a huge fan, as you know. And thanks for doing what you do. You're moving the whole industry forward, and it's a pleasure to be with you.
Thank you, Kian. I appreciate the opportunity to partner with you.
Thanks for listening. We always would love to hear your thoughts and suggestions. You can leave them for us at podcasts@independent.com. That's plural, PODCASTS, @independent.com. And make sure you follow us on your favorite podcast platform. I'll be ruminating with more thought leaders on future podcasts and do hope to see you then. In the meantime, stay healthy and happy.